Um, Today I'll be talking about how cloud-based population management and case management applications can help us with our triple aim goals. So reducing cost of care, improving population health, and improving patient experience. In particular, I'll talk about how that can happen in one of several areas, starting with targeting and managing discrete segments of our population, making care, particularly the communication around care, more accessible for patients, personalizing and engaging in new and powerful ways with patients, using those tools to help us through automation, and lastly, getting better information so we can make more informed decisions as care providers over time. So starting with the targeting discrete populations, if I were walking in a shopping mall and I saw someone next to me with a cart, and in it, they say a 30-year-old woman, and in her cart she had hand sanitizer and unscented lotion, soap, cotton balls, and some vitamins, it may not tell me a lot about her. However, if I was a statistician at Target Corporation, it would tell me quite a bit, because I could look at some of her patterns and pretty accurately determine that she may be pregnant. In fact, I think most of us have heard the story of the enraged father who started receiving coupons for baby items for his teenage daughter, and he stormed over to the local Target store and started to yell at the store manager about, how could you be sending this to my teenage daughter? She's not pregnant. What are you thinking? And the store manager apologized quite profusely and called back about a week later to say, hey, we're really sorry, and hope you'll forgive us. And the father sheepishly shared that I guess he didn't know all of what was going on, and his teenage daughter was in fact pregnant. Nor would I have a ton of information about a person walking next to me at a Home Depot or a Lowe's that might have a air filter or WD-40 in his cart. But his credit card company knows that based on the fact that he's buying preventative maintenance items for his homes, he's almost no risk at all for defaulting on his credit. So what these are simple examples of how other segments of our society are doing really interesting things with the data that they have to make more informed decisions and to change the way that they interact with their constituencies. And though we're making progress, I think in our industry we're still far behind where we could be. And sure, there's great stories such as the Camden Coalition with Dr. Brenner, who's just doing some really interesting things. If you haven't seen that story, and I expect most people in this room have, it's very compelling, right? How he went through and developed those hot spots largely on his own with some basic hospital data and police reports. And what he was able to affect there is phenomenal. And I know more and more organizations around our country are doing things like that and learning from that experience. But that's only the tip of the iceberg really for us. There's so much more that we can do with data that is powerful. And I guess the good news for us is even small steps can be really powerful. So in this case, identifying those few super consumers is saving millions and millions of dollars for those systems out in New Jersey. But the reality is those individuals are still at some point of advanced state with the chronic conditions they have. And though we can do a better job of interacting with them and reduce the number of times they'll spend in the ER, we still have to provide relatively expensive treatments for them for those conditions. Whereas if we could start to identify who those super utilizers may be 3 to 5 years, in fact, or maybe even slightly less than that, ahead of when their conditions truly start to become chronic and expensive to treat, we can dramatically reduce the cost of care for those individuals. So tools help us with those basic things. So as it was difficult for me to discern walking next to a woman in Target what she's buying things for, taking that information, taken in the context of other data points, becomes really valuable and we can make smart decisions. And cloud-based tools with robust analytics engines that allow us to combine data from multiple sources can help us do that. So once we have good data, we need to make it accessible to folks. And we're asking more and more of our care professionals today. We're asking them to deal with an ever more diverse audience, particularly as we think about expanding care and making it more accessible and more affordable. As part of that effort, certainly it's more numbers of people, but it's also more people that have historically been some of the most difficult for us to manage care for, particularly when it comes to compliance. So we need to do things that are going to help us be more successful, because we're still asking those individuals to provide the same level of personalization and interaction that we had in the past. Additionally, we're asking those individuals, and we're extending the care piece out to folks that don't have the training, the same training that doctors and nurses have, and we're asking them to make clinically valid decisions, which can be tough. So as we think about that, and as we ask those folks to extend their reach outside of the brick and mortar of a hospital setting or a post-acute setting and to different facilities, and in fact out in the field and sometimes to individual houses and other in-the-field locations, we need applications that are natively mobile, that allow us to take the information we have in the care setting and bring that out to the patient. So we have a feeling from that, they have a feeling from us of what's happening, and it's real-time data that we can access with all the other systems that we're used to having in the support setting. That information is also something that we want to share. We want folks to feel engaged. We need patients to understand that we're talking with them and not to them. And I've certainly been in this situation where I'm on the other side of the room and someone's taking a clipboard and asking me a series of questions. And particularly, depending on the situation or the setting, it can be off-putting. And you don't really have a feel for what is this person thinking and why are they asking me this question and what are they recording as they do it. You know, an opportunity to do that on a tablet-based device where I could sit down next to somebody and side by side they're seeing us record data together. In fact, sometimes they have him handing that tablet off to the patient so they can fill things out. And we're utilizing gamification concepts in some instances to encourage them to be part of their plan is really important. That same mobile application is going to help us find people when we're talking about Medicaid populations in urban settings or some rural settings where it's difficult to track those folks down. As a case manager, wouldn't it be great to come in and have something that shows me what my caseload looks like today and where I might find those individuals? I know in a project we did in Baltimore City, they were recording up to 6 different addresses for each of those individuals, stable housing being a significant challenge for them. So a mapping application within the tool that shows me all the points that I'm going to be, and that can help me with auto recalculating my route that day if I can't find somebody in some location, gives me minutes and hours each and every week that I can use to better provide care for folks that need my help. And as we have these tools and now we're out and engaging with folks, we need to personalize the message as we engage with them as well. Aetna has done some really fascinating work in this subject, and they looked at some basic things. So you think about metabolic syndrome, so the associated conditions that contribute to things like heart disease and stroke. And the traditional intervention strategy for metabolic disease is lose weight, exercise more, and maybe take a statin. But what they found was, although that's sound advice, it was almost never almost never adopted. The adoption rates or the compliance rates were abysmal for that. However, when they took that information and changed it and made it more specific to that individual, so for instance, based on that individual and their circumstances or comorbidities or what have you, they could say, hey, based on where you are right now, you have a 50% chance of having a heart attack in the next 3 years. People started to listen, and they started to think about what that caregiver was saying to them. Further, if they took the intervention strategy and they also tailored that and said, hey, if we could reduce your weight by 10 pounds over the next 3 months, get your blood pressure down 15%, and try a statin, we think we could take that likelihood and divide it into a third. So very meaningful, and the adoption rate on that was significant. It truly changed the way that those folks engaged with their caregivers. Further, so as we have these applications, we're working with folks, and we can show them that data. Tools can support that with integrating that data and that analytics based on that patient or patients similar to that patient and share that feedback. So as a caregiver, I can provide information that's relevant to the patient. And as we're talking through things, some of these patients have significant number of problems and would love to solve all of them right away. But the reality is that's not a viable strategy oftentimes. What we have to do is work with them to co-own what the problems are and prioritize those problems, and then also co-own the intervention strategies so that the patient is involved in making sure they make a good decision. And a tool that allows us to do that in a collaborative fashion is critical. So we can look at the different things. The tool informs us of what problems we might have and what interventions might work. And we can feed live data into there around what the success rate of different intervention strategies are, so the patient can make a decision on what works for them. And as we pick intervention strategies, have tasks auto-populated based on what we've seen in the past and learn from those experiences over time. It really changes the paradigm when you think about having that ability and being able to interact with the patient in that way. And those tools ultimately also help us with task management, and I think time management, I should say. And time management probably is one of the single biggest challenges I hear from folks when I'm talking to people in the space. In a recent discussion I had with the head of a cardiac surgery unit at a major hospital, he was saying how frustrating and how demoralizing it is for his staff that they have to sit down and enter information into one EMR, only to have that information to type it in, print it out, and have to walk it to another office, type parts of it into another EMR before they could fully process the patient. And how frustrating that was for him and his staff. And the reality is, it is frustrating. But cloud-based tools have some of the most powerful and innovative tool sets for integrating data. So we can pull and push data from multiple electronic medical record systems, from health information exchanges and other systems that are relevant, or other HL7 feeds, and we can integrate that into a really truly rounded view of what's happening with the patient. And we can allow those individuals to put that information in one time and have it replicated out to where we need it, or pull it from someplace else so I don't have to go track it down. This could be very powerful and reduce the amount of manual effort. And we can also instantiate workflows from within this application based on what we know works or doesn't work. We can be reminded of things that if we have a task that's waiting for us, or if someone's not in that day, I can auto reassign important cases to someone who is available. And calendaring, I think everyone's got basic calendaring down. But what about calendaring applications that can be expanded across individual groups to large communities of folks that can pull information from other systems like Outlook pull those appointments up into their calendar, and who can share that information in a meaningful way. And Dr. Nash, who is the dean of Jefferson over in Philadelphia, I think is one of, if not the only school that has a population health discipline, talks about his 50, I think he calls it a 50-50 rule, and he talks about 50% of his patients will actually fill the prescriptions he gives them. And the other 50% of that 50%, so 25%, will actually follow the course that he's prescribed to them. And how frustrating that is. We're trying to help folks, but only 25% of the time people actually do what we're asking them to do. Tools like this, where we can extend that calendar out to the individual and provide reminders for them around what's important and when they need to do things, can become very powerful, and they can support compliance in a way that we couldn't do before. And we can extend, the same way we extend the calendars, we can extend care plans and access to care plans. So imagine if we could, with that same patient at the end of our visit, say, hey, here's a login to a HIPAA compliant portal that will allow you to see all the things that we talked about today, and to access that information and see what tasks or events are coming up for you, and even set reminders for yourself over time. Also, as an individual, you can extend that information out to someone else. You can actually invite someone else to your care plan. So whether that is a coworker or a family member or community health worker, someone who you know and have a relationship, a non-traditional member of your care team can come and participate and see what's going on. So if my aunt was in Portland and I'm here in Florida and she invited me, I'd be able to get online and see what's going on with her, what her events are, what she has upcoming. And I can even collaborate using some of these tools today. I can collaborate with the care team. And one of the biggest challenges we have around communication is it's very gated today. It's unnatural. Most of our communication revolves around artificial things, appointments and reminder calls. And we need things that disintermediate that conversation for us so that we can have more effective discourse between patients and caregivers and allow us to share information more readily. So as the nephew of my aunt in Portland, I might be able to go out and say, great, let me see what's going on, and through a Twitter-like or Facebook-like interface, see what the communication has been between that case manager, other people on the care team, my aunt, and I can ask questions as well. It's really, really powerful if we can do that. And lastly, we need the ability to support better decision making. I had the opportunity, and it was really a pretty interesting story, to participate in an event last week in a major metropolitan area, and there was about 40 or so organizations, hospitals, and post-acute facilities that participated. And the goal there is to share information on a community-wide basis so that they can make better decisions around health outcomes, right? Readmissions, other meaningful events, falls, pressure ulcers, things like that. It's a great thing, and I think ultimately when it's done, it's going to be groundbreaking. The challenging thing in that meeting is we had a ton of data. Each table was laden with information, stacks and stacks of reports. Unfortunately, we spent we spent a good bit of time talking about data, looked at things and trying to determine, was it truly an anomalous data point or was it a mistake? Cloud-based applications can allow us to drill through that information where we can be looking at it on tablets or sharing it on a screen. And if there's a question about something, we can click right through and find out, was it really a mistake or was it really something that was just unusual, and make good decisions. And lastly, as we aggregate this information and we're learning from it because we're capturing each and every event, we can share it with ourselves and start to serve this stuff up in situationally relevant ways so that our caregivers can do a better job of providing care to the patients. So that's it for me. I sincerely, again, appreciate the opportunity. I hope everyone has a fantastic show. I hope you'll take a moment to stop and talk with Dan Bergner or Jordan Schroeder, who will be there, I think, watching this video today. And if not, maybe stop by. They'll be at the booth during the open breaks for that as well. Thank you so much.